The Kalamazoo Community COVID-19 Update is produced locally through Public Media Network.
Good morning, and thank you for tuning in. My name is Clifford Brown, and I am your host of the Kalamazoo Community COVID-19 Update. Today, we'll be speaking with Dr. Richard Van Eek. Dr. Van Eek is a epidemiologist and director of infection prevention. Did I get that right?
You got it perfectly. Thank you.
Wonderful. So for those of us that are not quite sure what that means, give us a little history on that. Tell us what that means.
Yeah. Well, healthcare is a difficult industry to be in, and sometimes there's things that we do in healthcare that could cause harm to us and make us unsafe. But it's possible to be very safe working in healthcare. So my job at Bronson is to make everyone as safe as they could possibly be. And that includes patients and staff and visitors, including all the doctors and nurses. So there's ways to do healthcare and make them safe, and that's my job.
Oh, wonderful. Well, this has got to be quite an exciting time for you. I know that's not necessarily a good thing, but I would imagine you've got a lot of years in studying for infection prevention, and here we are with one of the biggest infections in our lifetime.
That is absolutely true. It's kind of a strange thing for me because my job is to prevent things from happening, but also to deal with them when they do happen. And so this is a difficult time for everyone, but actually it's what I trained for. And it's what I'm educated in. And so in a way, this is kind of my business. So professionally, I think this is kind of interesting, even though it's bad times for the community and for patients. This is where I can, really practice my profession.
Okay. Now, is this one of those infections that keeps you awake at night?
Yes, it's a challenging process. We always knew that there were opportunities for pandemics or for difficult challenges for infectious diseases, and now one is right here. So now we're going to be able to see if our preparation worked or not.
Well, it seems like it's working, and we'll keep our fingers crossed. And I'm sure as long as we've got you at the helm, we'll continue to make progress. Want to tackle real quick, if I may, the elephant in the room, that being the protest that we had just recently in Lansing, where everyone is eager to get back to work as we all are. But let me ask you, what have you seen as the impact in COVID-19 on Southwest Michigan?
It's had quite a significant impact. If you look at the number of cases that we've had, it's significant. The number of people who are positive and at home taking care of themselves, and the number of people who've been admitted to the hospital, it's a significant outbreak. It's not a small number of people. And then when you add on top of that, the changes in people's lifestyle and their behavior and who they can communicate with and how they can do that and so on. What's not a good idea, in terms of sports and churches and all those communal activities. It's really changed people's lives. Mm-hmm. So I would say that I have never seen in my lifetime something that is this big in terms of the effect on people's lives.
Well, we can only hope that by and large, our communities, our families and friends are adhering to the stay home order. I know that we had a protest, but as I get out every now and then to the store, I'm not seeing a lot of activity, and it does make me feel rather good. But one thing that does happen every time I go out, and I've probably been out a couple times to the local store to get groceries, etc. The next day, I'll wake up in the morning and I'll have a cough or I'll sneeze or have a slight headache. And every time I do that, I go, okay, I wonder Is my number up? Did I just contract the virus?
Yep.
Well, let me ask you, what are the signs and symptoms? Help me with that so that I don't wake up every morning and feel like I need to rush over to Bronson.
Yes, yes, there are. There is some clarity in terms of what the signs and symptoms are. And the main thing is a fever. And without a fever, it doesn't seem like you're going to have COVID disease. And so that would be the main thing to be aware of. The fever tends to be what we call intermittent. That is, it's not constant. So if you take your temperature at different times of the day, it could go up and down. But pretty much every day, you're going to have a fever. And the people who have disease, it's quite a high fever. And so that's the most significant symptom that we're going to have for this. The other thing is that it's a pneumonia. It's an infection of your lungs. And so you'll generally have trouble breathing. You can't get enough breath. You'll have to take deeper breaths and so on. And then the other thing is a little bit of a cough. Sometimes it's more than others, but that indicates that your lungs are damaged and they're trying to clear themselves. And so the lung damage with the shortness of breath and the coughing and then the fever are the main signs of this infection. There are some others that people have reported. It's not completely clear whether they're caused by COVID or just other things, some intestinal problems and things like that. But the main thing is that it's a lower respiratory kind of infection associated with the fever.
I see. So when you say high fever, I'm thinking that's somewhere around 101 degrees.
Yeah, actually, that's pretty close. We're using as a screening temperature 100, because people can run 99 normally, if you're just exercising or whatever. So 99 isn't considered to be a fever, but we're using 100 as a cutoff for something that we would pay attention to. And so oftentimes these patients have higher fevers than that. So 101 would not be unusual at all for a COVID patient.
Oh, okay. Now, assuming hopefully this never happens, but if I wake up with a high fever, what should I do? What are the steps that I should take before coming to see you? And what should I do at home? Because I've got that cough, I've got that high fever, and I'm freaking out at this point.
Yes.
How do I stay calm and go through the protocol?
Yes. The key to that is to contact your doctor. And your doctor should know what your background is and what's normal for you. And they should be able to guide you in terms of what are your symptoms, what's your normal state of health, whether you have any risk factors, and they would be able to tell you and assess you basically over the phone or with a video visit, how sick you are and whether it's time to consider getting admitted to the hospital. But your primary care provider is by far the best person to assess you, and that's your first phone call.
Okay. Well, I should do that. I should remain calm and just make the phone call, right?
That's right.
Okay, I'll do that. Now, here's another thought. What are the requirements for COVID-19 testing? Because I've got a high fever. Now I'm calling my doctor. Now, at what point do I get the test, or is a test required?
Yes, we would test you if you just described, to me what your symptoms were. Your doctor should approve a test or order the test. The test is like any other laboratory test. It takes a doctor to order it. Mm-hmm. And so there's many ways to get a test or places where you can go to get a test, but it's still a doctor's order that is required. And then you will go to that location, either in the neighborhood, what we call curbside testing, where you don't even have to get out of your car. or you can go to an emergency department if you're sick enough to do that, and they'll get the test. But definitely the fever, the shortness of breath, and the cough are make you eligible for testing. The testing is not, there's not enough tests for everybody that wants to be tested. So we're still testing people that are at highest risk and have those signs and symptoms.
Okay. So when you say those that have the highest risk, are those other contributing factors?
Yes, exactly. The patients who have higher risk of COVID are pretty much known. And the risk factors are, number one, age. The older you are, the higher the risk, beyond maybe about 40 years or so. So, 50s, 60s, 70s, 80s, the risk increases the older you get. The second one is heart problems. If you have a heart problem and you have a pneumonia, it's harder for your heart to pump the blood through your lungs. So that's a risk factor. If you have underlying lung disease like COPD or something like that, that's a risk factor. If you have high blood pressure, hypertension, that's a risk factor. If you have diabetes, something like that, that's a risk factor. So then all those risk factors are cumulative. So the more of them you have, the higher risk you are. It's not like you're in a risk group or not. The more risk factors, the higher the risk is. So if you're in one of those risk groups, then that increases the likelihood that you're going to have COVID, and it's easier to get a test.
I understand. So I could be, for example, I'm getting pretty old. That's a risk factor. But if I don't have the others, then I may not receive the test, just not have enough of the factor to really warrant testing.
You would be at lower risk than somebody else your same age that had a lot of those other risk factors. Yes.
Okay. Well, now we've gone through that. Now tell me how I can prevent contracting the virus.
Yes. I'm going to give you a little lesson in virology now. So,
okay.
We're going to talk about how the virus is transmitted from person to person. It's a respiratory virus, so it lives in your respiratory tract, in your lungs. And because it's in your lungs, it comes up through your throat. And then if you cough or sneeze or whatever, it can be in your respiratory secretions. Mm-hmm. And if you cough or sneeze directly on someone within about 6 feet, it can be transmitted directly from you to that person. But more commonly, you get it on your hands, and then you touch something, and then somebody else touches that, and then they touch their mouth or their nose or their eyes, and then they get it into their body. So if you don't touch your eyes or your nose or your mouth, and you keep your hands clean, there's no way you can get COVID. Okay. So that relates to the washing your hands, which is important, right?
Right.
And then wearing a mask, because that protects your nose and your mouth and protects you from touching your face all the time.
Okay.
And then the physical separation between people is important, because if you stay 6 feet away from somebody, you can't cough or sneeze on them. And so then everybody stays safe. So if you wash your hands, protect your face, and stay 6 feet away from people, you can't get this virus.
Huh. Interesting. That's very good to know. But now I've heard that the virus can live in the air for a couple hours. It can live on surfaces for 17 hours. What are some of the myths of contracting, and are any of those true?
The virus doesn't really stay alive outside the body for very long, or as soon as it leaves the body, it starts to die. So the question is not how long does it survive? The question is, how long is it infectious, or how long is it transmissible? How long before, when you touch something, you'll get the virus? And that's not very long. That's a matter of hours. And so if you cough or sneeze or something and you touch the table, that you're on, or a glass or a cup that you've touched, that virus is not going to stay alive or transmissible for very long. It's a matter of hours. So it's not like some other infections that stay alive in the environment for days or even weeks. The virus is dying, and it becomes non-infectious after just a matter of hours, 2 to 4 hours or so.
Okay, very good. I have a little bit more comfort. I'll still adhere to the stay home order, but I'll have a little bit more comfort as I go out.
Yep.
I've got a couple things that I would call them myths, and I want to toss them out to you, and if you would kind of debunk them for me.
Yep.
One is that on, I guess it's Facebook, it says that you can get boiling water, add lemon peel, lime peel, and vinegar, and kind of get a steam and cover your head with a towel and eliminate the virus that way. Secondly, I understand that COVID-19 is really not a virus. It stems from 5G technology. Have you heard those two?
I've heard that, yes.
Help me with those.
Okay, I'll take the steaming treatment first. What you described is very valuable if you have a respiratory tract infection, because it moisturizes and it helps soothe the mucous membranes in your respiratory tract. So it's a symptom treatment, but it doesn't kill the virus. So if you have pneumonia or if you have a respiratory infection like a sore throat, it will make your throat feel better because of the moisture and so on. And people will stay away from you because you have your head over this pot of water. They think you're crazy.
That's the social distance thing, right?
That's the distancing thing. What is he doing? Yes. And you put a towel over your head, and then you kind of shut the world out. So that's a nice way to meditate and things like that. So that treatment is actually very good in terms of making your respiratory tract feel better, but it's not going to do anything for that specific virus. So it's not a treatment, and it doesn't prevent the virus. It just soothes the inflammation of your respiratory tract. In terms of the 5G network thing, that got started several weeks ago, and it probably had to do with coincidence. That is, communities started to install the 5G network towers and things in their communities, and that's about the time that COVID seemed to emerge. So people said, well, they must be related to each other, and one must cause the other, and they don't. The 5G network has nothing to do with COVID. They're not at all related to each other. So don't worry if you're near a tower or anything like that. You're not going to get COVID from that.
Okay, thank you. I actually have a relative that has said it's not a virus. It's 5G technology. Okay. And of course, you want to go, you don't really believe that, right? So I wanted to ask you that just to get confirmation.
Sure.
Now, one thing that we are seeing is that in the African American community, we have a higher propensity to contract the virus. We're seeing that quite a bit across the country. Why is that?
Yeah, I would say it's probably not true that African Americans are contracting the virus. I think they're having more disease associated with it. And it has to do with several different factors. The virus seems to attack men more than women. We all know that women are the stronger sex, right?
Of course.
That is true. That is true for nod your head. That's right.
That's right.
That's true for COVID as well. Men get it more often than women do, and men get it worse. So there's some genetic difference there. And the ratio is quite dramatic. It's like 45% women and 55% men. So there's quite a strong, favoring women over men for this infection. We don't know exactly why that is. whether they're just exposed more or whether they refuse to go to the doctor more. We don't know what the basis for that is. But all we know is that for the patients who are admitted to the hospital, there's a lot more men than women. The second thing is all those underlying risk factors tend to have higher prevalence, be more common in African American men, right? High blood pressure, diabetes, things like that are more prevalent in African American men, and sometimes they're not as well managed because of access issues. And so there's an issue there. The other issue has to do with where you live and the density of housing. The closer people are together, the more likely they're going to be 6 feet from each other and transmit that infection. So where you live, if you live out in the country in a home and your nearest neighbor is a mile away, how are you going to get COVID? But if you live in a neighborhood with lots of people, then you're more likely to get it. So there's multiple risk factors there, and you add them all together, and African American men, when you add them all together, tend to have more risk than other people.
I see. So in your estimation, you can't tie it into genetics, or you're not predisposed because of the genetics.
Not that as far as we know. No, not as far as we know. It would be the same thing in China or in any other culture. If you add those risk factors and the density of housing, that population would be at risk regardless of race.
Okay, very good. Now I know that I've got to wind up here and let you get back to work. I know patients are waiting for you. Got one more question, if you would. In terms of we've gone through the prevention and the testing, et cetera, but it seems like the treatment is quite extensive. Up in as much as 14 to 17 days.
Yeah.
What is the treatment for COVID-19?
Yeah, there's no specific drug for this virus that is proven to be effective and approved by the FDA yet. There are some investigational drugs. One is called remdesivir, and some hospitals are getting that drug. It's not been approved by the FDA yet, but they're doing the trials now. And so, it's a brand new infection, and so we don't have any specific drugs for it. And there's some other treatment approaches. But basically, the treatment that we have for COVID now is what we call supportive care. So if you have shortness of breath and difficulty breathing, we'll give you some oxygen, with a tube, and let you breathe a little more oxygen to make sure that the oxygen level in your blood is good enough. And then if your lungs get too badly damaged, we can breathe for you. It's called putting the patient on a ventilator. And if you put a patient on a ventilator, then the machine breathes for you and will take over the work of breathing for your body as you recover. So it's basically, hydration and nutrition, make sure that the patient has fluids and nutrition, and make sure that their lungs are working. And then we can keep the patient going like that until they recover.
Wow, that's interesting, because one of the things that you did say is that it's pneumonia. However, we're keeping a patient hydrated, which means that we're giving them more fluid, and that doesn't impact the pneumonia at all?
No, it really doesn't. You get rid of water in every breath that you take. So if you just keep breathing without hydrating, you're going to get dehydrated. So it's very important that we have these patients on IV fluids and so on to keep them hydrated. Otherwise, they'll lose too much fluid.
Wow. Okay. Well, Dr. Van Eek, you have given me a tremendous amount of information, and I'm sure that our public will appreciate it. I'd like to keep going, but I know that you have to get back to work, and we have time limitations. I certainly thank you for coming in.
Okay. Can I go back to one other question that you had in terms of Who should you call if you think that you're sick? If you don't have a primary care provider, there's a number that Bronson has that will help you and advise you in terms of assessing you for COVID, and it's called the Bronson Care Advisor. And there's a telephone number. Do you want me to give it?
Absolutely. If you'll give it to me, our audience will hear it, but we'll also have it up on the screen for them. So please do.
Okay, it's 341-7788. 341-7788. And if somebody calls that number, they can be assessed by a medical professional, and then they will help them determine whether they need to be evaluated for COVID.
That's excellent, because we talked earlier, and I told you I'll wake up with a slight headache and a cough, and so instead of being alarmed, I can make the phone call, assess my health condition, and then determine whether I need to go further or take a trip to the hospital. Right?
That's right.
Excellent. Well, listen, I've enjoyed our time. I certainly hope that we can get beyond the virus real soon. Something tells me we're in for quite the ride. Maybe 4 to 6 weeks is what I would guess.
Yep.
But I certainly appreciate you showing up for Kalamazoo. And of course, I'd love to come back to you in a couple weeks, and let's do it again.
Please do.
All right. Well, again, thank you for your time. Be safe and enjoy your day.
Thanks, Clifford.
All right. Have a wonderful day now.
All right.
The Kalamazoo Community COVID-19 Update is produced locally through the Public Media Network. Our goal in this and subsequent broadcasts will be to provide you with the most up-to-date local information concerning the health of you and your family throughout this most devastating pandemic. Our community is braced and consistently preparing to handle the medical, emotional, and social needs of our families and friends. Please adhere to the advice of our governmental and community leaders. They are working tirelessly to provide you with information that will make a difference. Our broadcasts are likewise poised to provide you with updates of when and where you can find essential resources. We hope you'll receive this information with the care and urgency necessary to keep our communities thriving. Please be safe and make wise decisions. Thank you.
Hi, I'm Zach with PMN, and today we're going to talk more about the importance of social distancing and how you can keep yourself busy for the next few weeks. We as a community need to remember to stay indoors as much as possible. Only go out in public for groceries and other supplies you might need during the quarantine. It's very important to keep a 6 to 8 foot distance between you and someone else in this situation. Doing yard work and going for family walks outside is still safe, and it's also a good time to read your favorite book, or call a relative to check in on them. There's also many ways you can keep yourself updated and entertained with technology. You can check social networks for updates anytime, while also streaming your favorite television show or playing your favorite video game. Take this time to watch your favorite online videos and share them with people you know. For more information on how you can stay safe during the virus, visit publicmedianet.org.